Hi everyone, my name is Abby and I am the co-founder of VAMPIRO, the first and only dual lumen pool suction sleeve for laparoscopic surgery. As you all know, minimally invasive surgery is a rapidly growing field. With that, there is an emphasis on infection management. There are three basic principles of infection management. They are to control the source of contamination, to reduce the bacterial inoculum, and to prevent recurrent or persistent sepsis. I'd like to draw your attention to the second one. This is where we believe the VAMPIRO has an opportunity. Now, to better understand the problem of the existing single lumen spot suction catheter, we found that it inefficiently removes large volumes of contaminated fluid that's requiring additional time and effort. It's often occluded by tissue and debris, which is one of the variables that can cause an increased risk in surgical site infection. This is where we saw an opportunity for innovation. You are all familiar with open surgery, the spot suction and the dual lumen pool suction. Yet, in laparoscopic surgery, there is no true dual lumen pool suction sleeve. These are the cases where we saw it would be helpful. For example, general peritoneal contamination or a small bowel perforation. And all of these specialties would benefit from the use of the VAMPIRO. So we designed the solution. The VAMPIRO is an accessory device to any existing spot suction catheter. You can see with the increased distal apertures and the connecting grooves for enhanced suctioning, the gasket for a universal fit, and an ergonomic flange for easy manipulation. This was designed with the feedback of over 200 surgeons. As you can see in the video, there's very effective suctioning, especially in the dependent portions of the abdominal cavity. Now let's take a look at our market. The laparoscopic device market will reach $15 billion by 2025. There are 15 million laparoscopic surgeries globally, with about 5 million of those being in the United States. So based on that 15 million procedure number and our customer validation, we estimate a 33% obtainable market, where the VAMPIRO would have a clear defined use, thus creating a $240 million market. Now from another perspective, deep site surgical infections cost the U.S. annually $3.5 to $10 billion and can increase the length of stay for our patients from 3 to 20 days. We believe that the VAMPIRO can help reduce the bacterial inoculum, which could potentially impact these statistics. Now I'd like to tell you about our timeline. So we actually did a soft launch back in 2018 with 500 devices on the market, and we received some great feedback. With that feedback, we decided to make some redesigns to the VAMPIRO to give it a universal fit with all of your single lumen spot suction catheters. This was about the time that the pandemic started. So we took a step back, a pause, and reassessed our business plan and our opportunity. Now, in 2021-2022, we are looking to launch our redesign of the VAMPIRO with a more universal fit and have a nationwide launch. We are also beginning the research and development for the Zeka, which is the second product in our portfolio. Now, to take you through some of our revenue projections, I'd like to focus on our year 5. We estimate 2.4 million units sold annually and $115 million in gross revenue. This is assuming our $48 price per unit and 11% increase in year-over-year penetration rate. Now on the expense side, I'd like to take you through some of our unit economics. With a $48 price per unit and a $12 cost per unit, that gives us a 75% gross margin. Now if you add a commission fee of 30% on that top number, that gives us a 45% contribution margin. Now I can share with you that we have quotes from several vendors for sterilization and packaging, and we anticipate that we're able to decrease our cost, especially with increased volume, which will also increase our contribution margin. With our sales and distribution structure, we initially, especially in our soft launch, began with physician champions to try the product, which then turned into initial customers. We've started to attend more nationwide conferences, and we plan to establish a national distribution. We learned from our soft launch that going with individual sales representatives would not be the ideal route for us, so we've already identified a nationwide distributor that will be the ideal partner for us when we are prepared for our launch. And then our exit strategy is to license or have the company acquired with someone that aligns with our true mission. So $30,000. This is a game changer for us. Today, we could commit to packaging redesign and shelf life testing, which will help us launch our first batch of the VAMPIRO. With $150,000, we could complete all of our validation and shelf life testing to launch a larger batch of product. And finally, our long-term funding goal of $400,000 would help us build up our inventory, salary for one full-time employee, sales and marketing fees, and an FDA consultant. Here is our team. We have clinical and business expertise and advisors in various strategic areas. Thank you all for your time today and for having us here. I'd like to invite Dr. Santanello up to assist in the Q&A portion of our presentation.
So let's turn it over to our panel of judges, and I'll just open it up for questions from the judges right now.
Sure, thanks. Great presentation. I appreciate your clarity as you went through it. You're basing 5 million cases as your potential market. Do you have any research on what number of those cases actually use suction? Because there's a whole bunch of laparoscopic cases that don't use suction at all.
Correct. And we're not looking at the uncomplicated laparoscopic cases. We're looking at those complicated cases. And now as the acute care surgery field expands, a lot more of our surgeons are doing the complicated cases laparoscopically. We don't see 100% market saturation, but through our discussion and validation with surgeons, it appears that our product could be useful in about 30% of those patients, which are those complicated laparoscopic cases.
So your market analysis is 33% of the total laparoscopic cases potentially are complicated enough to justify suction?
Yes.
Gotcha. All right. And then the trocar size, I know you're working on another generation for the 5 millimeter ultimately, but what's your trocar size right now? What's the smallest trocar you can use?
10 millimeter.
10 millimeter. All right, thank you.
Yeah.
I have a question. So I saw a very nice video of you sucking saline, but every suction device sucks saline very nicely. So do you have videos of sucking non-saline?
Yeah.
Problem?
The problem is, yes, sucking saline is not difficult, but only difficult when it's in the recesses and surrounded by bowel. And I've always been frustrated by the fact that I couldn't even suck saline out when I'm in the pelvis or in the dependent portions of the abdomen.
Do you have any data at all to support that sucking that fluid out will actually, compared to a regular suction device, will decrease the incidence of infection?
I think that the data is equivocal on how much irrigating and suctioning contaminated fluid. We feel that, and intuitively as surgeons, we don't want to leave pus behind. And we think it is potentially one of the variables that can result in deep site surgical infections.
If you can show us some data on that, I think you have a huge winner.
We would like to do a study, but we were told that it would take thousands of cases in order to prove that.
Okay.
So the inner suction catheter that you're using is actually just the standard 5 millimeter laparoscopic suction device, is that correct?
For those of you who may not have seen this, this is a regular 5 millimeter, what we call spot suction catheter, because it just suctions at the tip. And so what we've created is this pull suction sleeve. It's a multi-aperture sleeve with grooves that help direct fluid through it. And just like your open pull suction catheter, you now create a dual lumen, which the physics and dynamics of it allow that to fill up with fluid, and then you're actually sucking the fluid and not the tissue. So it's really, it really mimics the open pool suction catheter. Yeah.
I have one other question. Don't you need an FDA consultant first,
So we
as
did
opposed to
have-
later?
We did have an FDA consultant. I'll let Abby.
We did have an FDA consultant, especially for our initial product design and our soft launch, so we completed that. So just be bringing it on for more continued use and staying up to date on all of our regulations. We are a Class 2 exempt product, so we received the clearance and we've gone through an audit already actually successfully, so we would be prepared for that in the future as well.
Great.
Abby, nice job on the presentation. You mentioned that you launched in 2018, that you went through a redesign in 19, COVID happened, and you had some lessons learned. Can you speak to what you would have done differently, knowing what you know now, when you initially launched?
Absolutely. So I think two things that come to mind for me, with the product redesign and the market research that we were able to do in 2019 and through the pandemic is we were originally designing for what we thought was the most common spot suction catheter, this striker device that's in your hands. But depending on what region you're in, and all of you might see this as well, there are different spot suction catheters that are commonly used in a hospital. So we want to make sure we designed a device that could fit all of them, and we had a market that, as such. Second, we began with using some 1099s, independent sales representatives. And one of the biggest lessons we learned is that's not going to be the most effective route for us to get to market. It requires a lot of time and due diligence and boots on the ground. So one of our largest learnings from our soft launch and how we've prepared for that in the future is identifying a nationwide distributor that has representatives, can manage them, and also warehouse the product across the country.
Can you speak to that contract in more detail? How is it going to work in terms of your go-to-market strategy and getting your device into physicians' hands and also getting it approved in connection with the CPT codes that are necessary for that?
I think our goal is to get a national distribution system where representatives are already in place, rather than going to either independent or smaller company distribution. We found it, as Abby said, very difficult in order to penetrate the market. And then your second question with CPT codes, can you be a little more clear on that?
Yeah, I'm wondering, how is this getting paid for? Is there an existing code on the market? Do you need to apply for a new one?
We would have to apply for a new code.
Okay. Thank you.
I just want to add with the pricing that we identified this $48 price point because we, with our customer validation and talking to different champions in this field, that under $50 was an ideal price point, and that there was no challenge or difficulty with hospitals paying for that. And we saw that because we had early customers, early contracts, and some repeat customers as well. Of course, with volume, we'd love to make this more of a commodity device and drive that price down, and we think we have the potential to do that.
So Abby, you, I'm sorry, I feel like I'm really loud. So, apologize about that. It looks like the tip's designed to be able to extend beyond the end of the, is there some way, logistically, when you're using it to know whether your tip's extended beyond once it's in the trocar? Is there a click mechanism or something like that?
It's really intuitive. Number one, you can actually see it laparoscopically, and then when this is fully engaged, the tip is exposed. Is
there a certain sweet spot that you want the tip in when you're trying to use the pull suction?
There isn't. I will say that, approximately halfway up, or looking at the level of fluid that you've entered is one way to guess it, but you can easily manipulate it until you feel as though you're getting maximal suction.
I'd reinforce what Dr. Saki was saying as he said that. I thought about it more. A nice little lab study that you could do would take various particulate matter and compare standard pull tip versus dual pull tip and show potential differences of that. I think that would be, even with just, standard type lab particulate matter, you could potentially show us the benefit, and that would be helpful.
Okay, thank you.
Have you tried all the suctions on the market?
Yes.
All of,
Well, I don't want to say all, but the most common, there's approximately 4 companies that make spot suction catheters that predominate the market. In our research, we found that Stryker had about 75% of the market, and that's why we initially engineered it to the Stryker catheter. But then we were getting a lot of feedback that, there was Coden and Medtronics, and, it didn't quite have the same fit and feel that the Stryker catheter had. And that was part of our redesign.
Your 5 millimeter, will it be its own suction device in and of itself? It'll be all inclusive?
It's a total secret right now.
Oh, total secret. Well, it's at least worth asking, right?
I just want to follow up on one question that was asked earlier about the ability to suck blood. You guys got off on a tangent about sucking saline in the pelvis and so on, but what's, we're all, well, certainly I'm not, but many here are familiar with trying to suck large volumes of blood out of the belly and clot and so on. So how well does that work under that setting?
And having used this personally myself, and my testament, and I can't speak for others, I had no problem sucking pus, bile fluid, and or blood with the pull suction catheter. To me, it's no different than using an open pull suction catheter, and we've all had experience using open pull suction.
Excellent.
Now, chunks of corn or food things, no, it's not going to suck it up.
Excellent.
Thank you.